Hello, I'm Gene Preuss with Houston MediaSource TV, and we're here to commemorate World AIDS Day 2023. With me, we have three very special guests. We have Pete Rodriguez. Mr. Rodriguez is a graduate of Texas Christian University and has been a nurse for the past nearly 50 years, beginning as an emergency room nurse in Fort Worth, and then working in the field of HIV nursing since 1986. He is here in Houston, and he was in the first nurse care cadre at Ben Taub Hospital. After 23 years of career in HIV nursing with the Harris Health System in Houston, he retired in 2016 as Director of HIV Services, which provided medical care for over 5,000 persons living with HIV, and as Director for the HHS, Healthcare for the Homeless Program, and FQHC, which has provided medical and dental services for at least 10 homeless shelters across Houston. Our next guest is Dr. Charlene Flash, who's the President and CEO of Avenue 360 Health and Wellness, a 8-site health system here in Houston that provides cradle-to-grave care when addressing social determination of health, such as housing instability, food insecurity, and racism. She is an infectious disease physician who holds voluntary faculty appointments as an associate professor at U of H and at Baylor College of Medicine as an assistant professor of medicine in the Division of Infectious Diseases. She launched one of the first HIV prevention programs in the U.S. outside of a clinical trial. And we have also Mr. Jeffrey Campbell, who is a native of Cuero, Texas, a gobbler.
I am a gobbler.
A gobbler,
yes.
And is a graduate of Texas State University, Bobcat. So I'm right with you on that. He works as Chief Executive Officer of Allies in Hope, which was formerly AIDS Foundation of Houston. He spent over the past 20 years working in the field of HIV prevention, which also being heavily involved in the LGBTQ advocacy in Houston and around the nation. So I want to welcome you all. We're going to talk a little bit more about what you're doing and your backgrounds as the show progresses. We're here to celebrate World AIDS Day, and this is over 30 years of World AIDS Day. And of course, AIDS affects not just us here in the United States, but also, as the name implies, the world. I'm a university professor. I was talking to some students yesterday in preparation for the show, and I said, "What is AIDS?" And I was really surprised that a lot of students, a lot of young people, and probably many adults as well, don't know what AIDS is. So Dr. Flash, can you give us some medical background on HIV and AIDS and what the difference is between the two of them, please?
Sure. HIV is a virus. Its full name is human immunodeficiency virus. And this virus can do lots of things to the body. In fact, in many ways, it's known as the great pretender. It can present like a sore throat. It can give people headaches, make them confused, give them a rash. It can do lots of things. But what it particularly likes to do is to attack people's immune system. This is what makes it a really sneaky virus, because it actually weakens a person's ability to protect themselves. Now, when that weakening of the immune system becomes so profound that a person is now at risk for unusual infections called opportunistic infections, or infections that take the opportunity to get you when your immune system is weak, that's when a person has progressed to what's known as AIDS. AIDS is the acquired immune deficiency syndrome, and it's acquired by having HIV for such a long period of time that your immune system has been severely impacted, and your body's ability to protect itself from things that when the rest of us are exposed to, you walk on by, it really impacts people and can shorten their life expectancy.
So how long have we known, or we're celebrating the 30 plus years of AIDS Day, but that's not when AIDS started. How long has AIDS been around?
I say AIDS started, well, it became on the radar screen about 1982. Something was going on in New York and San Francisco among gay people, gay men, And they didn't know what it was. But there was a pattern. It was in a certain group of people, and the numbers kept growing. And these people got very, very sick and died. And that's when it really hit. All of a sudden, the numbers got larger and larger in about 1985, 86. That's when people named it something. Before, it was just a disease among gay men. It was a gay disease. And then it became an official human immunodeficiency virus syndrome, or HIV. So around 85, 86 is when it really hit the radar screen.
So I was in high school in the 80s and getting out of high school in the 80s. I remember watching TV and watching the news, and I was involved in, watching politics in those days. And I remember hearing reports of a wasting disease, or a disease that was affecting Haitian immigrants and gay men. And didn't really know much about it. I lived in a smallish town in central Texas. But after I got out of high school, I started knowing people that had signs like Kaposi's sarcoma was the big sign, which was lesions, giant spots on the skin. It looked like maybe starting off as a mole and it would spread. What is that? Is that still a big sign?
Absolutely. So Kaposi's sarcoma, or KS, is a form of cancer that impacts people whose immune systems are very weak. And it is considered an AIDS-defining illness for people who've been infected with HIV. It causes these raised red, almost violet lesions on the skin that can be very large. They can be inside the mouth. They can be inside the body, on other mucosal surfaces inside, but they can also be on the skin. Now, usually it's a sign of someone who's had the disease for some time and it's progressed. So I always want to catch HIV well in advance of someone presenting with KS. But if someone comes into your office and they have KS, it is likely that they likely have HIV and probably AIDS as well.
So can you tell us a little bit about when you were working, Pete, as a nurse, and you were in Dallas at Petersen Hospital? What was it like to see some of these early patients that were coming in?
Well, I'm reminded of the first patient I ever saw with AIDS. It was back in '86. And going back in those days, remember there were no computers, no cell phones. I wore a white uniform. Nurses had white caps. I worked in the emergency room. If a gunshot victim came in, there were no gloves. There was no universal precautions. So one night, a young black girl came in. She was about 2 years old, extremely malnourished, lethargic. She wouldn't respond to us. So I started an IV on her, no gloves, drew blood on her, no gloves, held her for lumbar puncture, no gloves. And she moved her arm a little bit, so I had blood underneath my fingernails. Well, that morning, I took a Q-tip, broke it, and it was cleaned the blood out from under my nails. Her mother was an IV drug user, so we just immediately thought child neglect, child abuse. Well, we got a call a few days later, she died, and she died of AIDS, which my staff, we were just in shock. What's AIDS? Do we have it? Are we going to die? I knew nothing. I was in charge of the emergency room and my team, and I felt very responsible for my staff. What have I done? I should have known about this. So that was '86. So infectious disease, there was nothing. Nobody knew how to even take care of a patient. So in those days, we would gown up. We put on a head cover, we put on masks, we double gowned, we put on gloves, we put shoe covers, because we didn't know how to treat patients.
This was even in the medical community.
This was in the medical, and this was John Peter Smith in Fort Worth. We were part of a medical school. Nobody knew what to do. So these poor patients that would come in and tell us, I have HIV, were immediately put into an isolation room. And I felt comfortable going in there, but some of my staff didn't. They didn't want to go in that room. Doctors didn't want to go in those rooms. So that's what the early days were like. We didn't know what to do. I left working in the emergency room and I started working for the health department doing HIV education and outreach. And so my job was to, every day I would test people from 8 in the morning till noon, and I had people lined up in chairs. All these gay men who, like myself, were terrified. Because in those days, if I gave you an HIV diagnosis, I would shake your hand and tell you, I have something terrible to tell you. There's no medicine for this. There's nothing we can do for this. Try to get a support network, try to de-stress yourself, eat well, don't drink a lot, protect your health. But I have no pills to give you. And there's a good chance you will die of this. If a woman came in, we would tell the women, do not get pregnant. Your baby will probably have a horrible life and will die. Do not get pregnant. Those were the early days. That's what we had. As healthcare professionals, we could tell people what they had, but we had no pills. There was nothing back then.
It was really a hopeless prognosis.
In those days, it was a hopeless prognosis. You know, I remember when I got my test, and it was, I felt like I was reborn when they told me I was negative. It was truly, I felt reborn, and I felt I need to do something. I need to devote my life to this, because somehow, and it reminds me so much, you know, in the Bible, when the Lord said, I'm going to strike dead anybody who doesn't have the blood of a cross on their door. I will strike you dead. And I felt I had the cross on my door. For some reason, unbeknownst to me, because I was at risk. I was at risk. Being a gay man, I was at risk for it.
And not only that you were gay, but also that you worked around blood and fluids and people who had the disease.
Absolutely.
I mean, that must have been just, I mean, were you not terrified?
When I first found out about it, when we had our first patient, like I said, we had no idea. We had no idea. And I remember when I was doing the testing and counseling, I had a young teenage girl. She was 18 and she was at one of the high schools. And she didn't want to come to the clinic, so I would go to her high school and meet with her there. And I was looking at her medical record when I got back to the hospital, and I was flipping through it, and she thought she had acquired it from her boyfriend who used syringes. But I looked through the record, she didn't tell me that she'd been stabbed. And there in the record were all these blood transfusions she got in our emergency room. And there was my name. Pete Rodriguez gave this blood. Pete Rodriguez gave this blood, because she was getting multiple units of blood. So there's a good chance when I infused her with that blood that I gave it to her.
But you didn't know.
I didn't know. But those were the early days. Those were the early days of HIV. As a healthcare professional, those were the early days.
Mr. Campbell,
Yes.
I want to come and talk to you a little bit because you've been a minister.
Yes.
And you were talking about the Bible, Pete, and I worked at a Christian radio station in the 80s, and there was a lot of discussion about AIDS. And as you were saying, you know, kind of the Passover event, but that maybe this was divine judgment. And there was a lot of negativity, not only in the Christian, but in political circles, Christian community and political circles as well. Can you talk a little bit about how we reacted? And a lot of this was out of ignorance, and we saw it again recently with COVID, right? How did this affect the religious community in those days?
Well, you know, and thank you so much. So, you know, the effect, the impact was huge, and it was painful. You know, I grew up in the church, the black church, more evangelical, traditional black church experience. I'm also a gay man. I didn't come out until around 30, but I'd known that I was gay for a long time. So it was a very scary time because I too saw people get sick and die. And the church, I would say, was just as unknowing and I would say ignorant, because ignorant means not knowing, as what Pete talks about the medical community was, but even more so with the church. And the church easily went to, this is a punishment for the gay community. Because you're gay, you're being punished. And so it caused a lot of people to not get tested. And even if they got tested and they knew they were living with HIV, and then during times when treatment came out, they would refuse treatment. And when I'm talking about this, I'm talking about individuals, predominantly black gay men, who played significant roles in the church, were leaders in the church, but they refused to go get treatment or go get any type of help because they didn't want anyone else to see them and know that they were at that clinic to get treatment. And many of them died. It's a very sad testament of the church. Even today, there's still a struggle. There's still stigma around being gay. There's also still stigma around living with HIV today, as we engage and attempt to incorporate the church in the work that we're doing. I do what I do because I believe I've been called to do it. I don't think I could do this work if I was not a gay man and a black gay man and a black gay man who grew up in the church. All of those things have contributed to the work that I do today and the way that I do it. And, Dr. Flash mentioned it in a pre-conversation around women. And a lot of times we forget that women, particularly minority women, Black and Hispanic Latino women, are highly impacted by this virus. And that's how I got in this work, by volunteering with a group of women who were living with HIV. That's how I got into this field. So, in some cases, the church has grown. In some cases, even here in Houston, St. John's United Methodist Church downtown, Brentwood Baptist Church in the Southwest, they were early on in the fight for housing, for the homeless, to provide testing. But there's just not many like them here in the Houston area.
Here in the Houston area, there were some first, the Montrose Clinic was among the first clinics in the nation to provide health care for HIV/AIDS patients. Dr. Flash, let's talk a little bit about debunking this myth that it was just gay men who contracted the disease. How did, there's people like Ryan White also, who was treated here in Houston. Can you talk a little bit about some of the other people who were affected by HIV/AIDS?
Sure. The thing that I would consider is that this is a virus in some ways like any other. And the virus doesn't know that you're gay or you're straight. The virus doesn't know that you're Black or you're white. The virus doesn't know if you're a man or a woman or if you're trans. The virus doesn't know if you're a Christian or an atheist. It doesn't know, right? And so when we think about who can get infected with HIV, anyone can get infected with HIV if they are exposed and engaged in risk. And we've heard some of that story here. It could have been, not now, but in the past, it could have been a blood transfusion. It could have been a needle stick as a healthcare worker. It could have been condomless sex. It could have been condomless sex between two men or between a man or a woman. It could have been through childbirth. These are all ways in which HIV can be transmitted, but again, the virus doesn't know. It's the behavior, right, that causes risk and causes exposure. And so when we talk about that, I always encourage people to talk about how do we reduce harm? And in order to reduce harm, that means that we need to educate people and have them be informed, because sometimes what we who are in the know call ignorance isn't really ignorance, it's lack of awareness. And so when we leave that void where people just can fill in the blank for themselves, they create a story. And sometimes the story is not accurate. And so I also would be remiss if I didn't talk a little bit about how it's changed today. Because I think Pete talked about what it was like at the beginning, and you were gowned up and gloved and people were in isolation. And I just want to make sure that we do pause to say that today what we know is that you cannot catch HIV from someone through casual contact, that you don't have to gown up and wear, a cap and all these things when you're engaging with someone who has HIV. That when I have a patient who has HIV, I go up to them, I'll shake their hand, I'll give them a hug. I am not nervous in any sense. Now, if I'm going to engage with their blood, I'm going to draw their blood or give them a vaccine, then I should put on gloves because I'm engaging with their blood. If I am delivering their baby and exposed to their sexual fluids in that way, then I need to have the appropriate precautions. And if I'm in an intimate relationship with someone who has HIV, then I need to wear a condom. Or I need to take PrEP, which is a medication usually used one time a day by mouth to protect people who are at risk of HIV from getting infected. But I just wanted to make sure that we talked a little bit about that, because though that was the fear at the beginning, we know so much more now, but sometimes people received whatever knowledge they got 30 years ago and it stuck with them. And so they still think, I remember a young man came in and he was diagnosed with HIV, and his grandmother had brought him in to Thomas Street Health Center, which is a part of Harris Health System. And she brought him into our testing unit. And she said, I think something's wrong with him. I need him to get an HIV test. And he got the HIV test. And afterwards, he pulled the team member aside and said, he lives with me. And sometimes when he drinks a Coca-Cola, I drink after him. Do I need to get tested too? And so it was so important to let her know that you're not going to get HIV from drinking after your grandson or using the same bathroom as him. And how important it is that if he lives with you, for you not to isolate and ostracize him, because in order for him to be successful in his care, he needs to feel affirmed and loved and supported through the experience of care.
That's those misconceptions are. I'm glad you brought up some of them. I remember when this was all in the news, and you were seeing people who were sick. It might be through the tears, right? So maybe if you hug them, you might be in danger. This going to sharing the bathroom. I just heard so many things that maybe, and we don't know, and what if, and we need to be careful. And you were talking about kind of putting on, the bunny suit before dealing with patients, and that we don't do that anymore. But it was almost like we ostracized them right from the beginning, right? We shut them off. We can't touch you. We can't interact with you socially. We can't even share physical contact because we were afraid.
That's right.
And so some of those fears still persist?
They do. And when I think back to my origin story for the work, it also was back in the late 80s when I grew up in Connecticut in the Northeast, and I'm a first-generation American. My family's from the Caribbean, from Jamaica, and I was the first one born in the United States. And the kind of family I had was the kind of family that if my mom took the train into the city, into New York, and she came back and she encountered someone who was suffering domestic violence or didn't have somewhere to go, she might bring that person home. If you were driving on the highway and you saw someone's car break down, we knew as a family that we were going to stop and help that person. And I can remember the first day that we didn't stop for someone who broke down on the side of the road. And I said to my father, why didn't we stop? And he said, well, there's this weird thing going around, this AIDS, and I don't know what they have. And I don't know if we're going to be exposed to their blood, and I just don't want to put you kids at risk or put myself at risk. And I can remember thinking as my young self that what is this thing that changes the way that these God-fearing, loving people engage with the community? And it changed this idea that maybe you can't help people anymore because you might catch something. And a family friend passed away, nobody knew why, and left 2 small children, and everyone ostracized those children, and no one talked about what she died of. And then I, as a young child, can remember the whispers that she died of the monster. Mm-hmm. And I learned that her husband had cheated on her, brought HIV into the relationship, and she got AIDS and she died, left her 2 children. And I said, what is this thing that's making people ostracize children? Mm-hmm. And I decided at that time that I wanted to commit my life to ending the HIV epidemic, because I wanted to get rid of this thing that was changing how people behaved and how they loved on each other. And that just felt wrong. And so much as I sit here with my colleagues and friends, we have had the honor and the privilege of watching this shape and mold and shift from you're taking a handful of, it's a death sentence, to you're taking a handful of pills and they're gonna make you gain weight, lose all your hair, the pills might be worse than the disease, to you're gonna be on one tablet once a day. It's gonna be easier to treat than your diabetes, your obesity, or your hypertension, and you're gonna be fine. You're gonna live a normal life expectancy, and you can get married, and you can have children, and you can have a happy and full life. And to have the experience of watching that transformation, it's really powerful. It's really powerful, because we've come a long, long way.
It's miraculous.
It is miraculous.
It is miraculous.
It is miraculous.
Jeffrey, in working with AIDS Foundation of Houston and then the transition to the new name of the organization, what were some of the people you've worked with, and what are some of the changes that you've seen?
So, I had the wonderful opportunity of working with some absolutely brilliant folks. Two of them are sitting at this table. But I think locally, because again, I have an accounting degree. I came into this work as a volunteer, and I didn't know that this was going to be my career path. And I was an adult, but I kept getting placed in the rooms with people who were doing the work, who had compassion, who had the intellect, who had knowledge. And they kept sharing that knowledge with me. They kept putting me in spaces and places to learn. So I give, and Pete, I don't know, do you know Alvernice Boyd?
Yes.
So Alvernice is responsible for me being the CEO of Allies in Hope. Alvernice had me volunteer with her women's group at Thomas Street many years ago. And the wonderful thing about that, there are women that were in that group back in the late 90s who are still alive today. I still see them. They still remember. But, again, there are individuals, Barbara Joseph, who is now deceased, who was a warrior in this fight against HIV. Former council member Ada Edwards, who was a city council member here. Councilmember Edwards was the reason why we had a state of emergency declared by then Mayor Lee Brown around the African American community and HIV back in 1999. Is that right, Pete?
So, yeah.
Yeah. So Dr. Stanley Lewis, who is a provider who for years worked with people living with HIV, and he's gone on now. He's on the pharma side. He's developing drugs to treat HIV. So those were some of the brilliant and compassionate people that I sat at their feet and I learned about this work. And, that I, give a lot of honor to for me being able to be CEO of this organization. And I do want to say this just about the history of Allies in Hope and our name change. The first name that we had, you mentioned Kaposi sarcoma. Back in 1982, when this organization was founded, it was known as the KS Committee, the Kaposi Sarcoma Committee, founded by a group of employees from MD Anderson who were them experiencing this new thing that was primarily at the time among gay men, and wanted to do something about it, wanted to provide some support, thinking, and at that time it was really the truth, that we're helping people who are in the last few months, maybe the last 18 months of their lives. How do we support? And so that's how the KS Foundation, or the KS Committee, was founded in 1982. And now 40 plus years later, we are Allies in Hope.
That's wonderful. The theme for World AIDS Day, the 35th World AIDS Day, is Remember and Commit. And let's talk a little bit, Pete, about in the nursing, because you remained in the healthcare industry until you retired. What were some of the changes that you saw, as Jeffrey was describing the changes that he saw in his work? What are some of the changes that you saw in the way it went from being a death sentence to being something that you lived with?
Well, I mean, as I said, in the early days, there was nothing. But then AZT came out, which was one of the first medications. And it was a trial and error. we were telling people to take 2 pills every 4 hours around the clock. And the good news is it was helping fight the infection. The bad news is it was wiping out their blood. So they would come in, get a prescription refill and a blood transfusion at the same time. But we learned we're giving them too much. Let's cut back. So it was trial and error. And then, in the nursing profession, as I said, there was no universal precautions. And we learned for everybody, you assume that they're living with HIV. If a grandmother, a baby, you wear gloves when you deal with fluids, with body fluids. So that changed the profession entirely. And then we had large AIDS units. I was in charge of a 60-bed AIDS unit in Park Plaza with all these patients that were so sick. But we also had research going on. Some of the early drugs, we had DDI, we had DDC, we had phoscarnet, things that and it was changing people's lives so they actually lived. And nowadays, as Dr. Flash said, they would take handfuls of pills around the clock. And now it's either 1 pill a day or, believe it or not, an injection every 2 months, which is astounding. It's called long-term injectables, which if you had told my patients back in the early days that I told there's nothing, if I said, come in every 2 months, I'm gonna give you a shot, and you can have a healthy life, and you can have babies, and you cannot infect people, they would have laughed in my face. That's where we are today. That if a woman comes in and she's of childbearing age, I'm going to ask her, have you thought about having a baby? Well, yeah, I'm going to have a baby. Okay, well, there's some things we need to do first. Let's look at your weight. Let's look to see if you're undetectable, if there's so little virus in your bloodstream that our lab tests can't pick it up. And let's talk about your partner, making sure he doesn't become infected. And you're going to have a big, healthy, beautiful baby. That's life. And that's what we're doing today because of these medications. So from where I started to where we are now, we have come so very far. One of the biggest problems we have is stigma.
Yeah.
I've talked what I do now is I go into clinics throughout the United States and Puerto Rico to make sure that they are receiving the clinical care that they have. And it's paid for through Ryan White funding, which Congress approves. And the Ryan White is named, again, after the young man who died. And so they give funding through cities throughout the United States and Puerto Rico. And I just talked to a young man who was diagnosed with HIV. And he said, I can't use the bathroom when I visit my mother. I can't use her bathroom. They have paper cups, paper plates for me. I can't drink out of the water. I can't touch my nephews and nieces. So this is 2024, and that stigma still exists in the world. And I ask you, if you were to come down with cancer and you went to your family and said, I have cancer, and they say, oh, Pete, you can't use our bathroom. Don't touch our utensils. Don't touch the children anymore. And you were given this diagnosis, how would you feel? Would you say, oh, I think I'm going to take my pill and live a good life? Or would you want to just lay in bed and stare at the wall and not participate in life? So for those people who do not have HIV, but it's in their families, think twice before you shut the door.
Dr. Flash, looking at public health, epidemiology, and the various factors as a physician, what are the changes that you see? We've talked a little bit about them, and certainly in the way that, when you go to a hospital now, it's much more sterile than it used to be. But what are some of the other changes you're seeing in dealing with patients and dealing with families?
So I think that a lot has changed. And one thing is that we now understand transmission. And so we can take the appropriate precautions. But what we've learned is that actually what's good for protecting people from HIV is good for protecting people from lots of other things. And so now those precautions, those protective measures, they're considered standard precautions. If you went to your doctor and your doctor didn't wash their hands, or the person drawing your blood didn't put on gloves before they drew your blood, you'd say, what's going on here, right? And so those standard precautions actually in healthcare are what protects healthcare workers from getting infected with HIV, but also from getting anything else that's kind of running around. Now, the interesting part about the messaging for this World AIDS Day, that concept of remember and commit, is that it's so important, though, that although so much has changed and it's much easier to treat and we understand how it's transmitted, that we still as communities need to commit to being well informed and to loving on the other members of our community. One of the locations within my agency, Avenue 360 Health and Wellness, is an AIDS hospice. I call it the jewel of our agency. It's called Omega House. And it was started by Miss Munger, a woman who, when there weren't medications, understood that people needed to have a dignified end where they weren't isolated. And so these people were being ostracized, and so she came around them. And she actually went to the religious community. For as much as we talked about how ostracizing the religious community was, it was the religious community that decided, some members of the religious community decided that our religion is about loving people. And when there is nothing else that you can do for these people, you can still stand by them and be with them. And we still have that AIDS hospice today, which allows people to have a dignified end and at no charge. And so I bring this up because today, in 2023, people still die from HIV and AIDS. And just because we have the medication and just because the numbers are going down in some communities, that's not the story for everyone. And so if any segment of our community is impacted in some way, because we're all part of the fabric of this community, then we all are impacted. And so that's why I say, listen, let's not forget the people who are impoverished and don't have access to health care, the people who are scared to share their social interactions, and so they don't tell their parent that I need an HIV test, the people who, they have only one lifetime sexual partner and that's their spouse, and they have a feeling that that spouse is cheating on them, but they don't want to believe it, so they don't want to go get a test. If we forget those people, then what happens in those communities, the rates will continue the numbers of new HIV infections will continue to grow, and we'll never put this thing to bed. We have to recognize that that commitment is still necessary today, and that if there is one new HIV infection, that's one new infection too many, because today it is 100% preventable. Whether by practicing the in-clinic measures we talked about, or by using condoms for intercourse, or by using PrEP. And we also, aside from the oral PrEP, we also have injectable PrEP. So now people can take an injection, you take an injection once a month and you are no longer at risk. And even having people who are infected with HIV get to the point where the level of virus circulating in their blood is at such a level so low that it's undetectable. That's not meaning that they're cured, but it means their virus is under complete control. Once a person's in that state, they're no longer able to transmit virus to other people. And that's not common knowledge, right? And so you have to have those conversations. And sometimes I'll have my patients bring their family members in and say, let me talk to them. Let me share that your viral load is undetectable, and they can hug you, and they can bring you to Thanksgiving dinner, and you can use the same bathroom, and you can plan to have a baby and do so safely. All the things that we take for granted.
You can be a human being.
You can be a human being, yes.
I looking at the numbers here, I was looking at the AIDS numbers, 39 million around the world, over 1 million, 1.2 million in the U.S. 13% don't know they have it.
Yes.
Right.
And that is but what you're saying now is that now you can have it and not even pass it on to somebody else. So Jeffrey, let me ask you a question. With what you're doing with Allies in Hope, what is your message today to men, because it's still predominantly the targeted community, the impacted community? What is your message to men of color, Hispanic, African American, who are at risk?
So I do want to say this. You talked about the percentage of individuals who don't know. That number used to be much higher. That percentage used to be over 20%, maybe 25% of people that were living with HIV didn't know. it was a lot of the work that organizations like Allies and Hope, like Thomas Street, like Avenue 360 have done over the years around testing that has helped individuals to know their HIV status. Now, you asked specifically about African American men and Hispanic Latino men. While I do and we do focus on those communities, we really speak to the human being, because that's the first letter of human immunodeficiency virus. It's human. And anyone at this point in where we understand HIV, the predominant way of transmission is sex. So any human being that's having sex can at any point contract HIV if they're having sex with another person who's living with HIV. You don't get HIV randomly just because you're having sex. You have to be having sex with someone who is already living with HIV. And going back to what Dr. Flash so eloquently explained, that person must have a viral load that's identified. It's not suppressed. And it's a lot of other science behind it. But what I say to people is, if you are having sex, it is important for you to, one, get tested, two, decide as a person who has been tested and you're not living with HIV, how you're going to lower your vulnerability or your risk to acquiring this virus. It's condoms, it's PrEP, it's oral PrEP, it's injectable PrEP. And again, it is also knowing your partner or your partners. That's very important.
So in the few minutes we have left, I want each of you to share a little bit of contact information where people can go to for more information, either about what you're doing, organizations that you support or that you work with. So Pete, we'll start with you. Where can people go for more information about the activities you're involved with?
Well, activities I'm involved with have to deal with going to clinics who provide HIV care. Something that the Ryan White Planning Council has is something called the Blue Book. And the Blue Book has a list of all the services that are available in Harris County and the surrounding areas. And these Blue Books you can find online. Just type in Ryan White Planning Council. It'll take you to their homepage. It'll take you to the Blue Book. And that Blue Book, get a hard copy. Everything's online. It tells you where you can go for care, for treatment, where you can go for testing, where you can go for support services as well, mental health services. So my recommendation is to go to the Ryan White Planning Council website, click on the Blue Book, and it'll tell you where you can get tested or where you can get care.
Okay, so somebody is thinking about getting into the medical profession, as a nurse or other type of provider, and we'll get to physicians here in a minute. But what do you say to them when they're thinking about a career like this?
In nursing?
Mm-hmm.
I'm a big proponent of nursing. I belong to the Association of Nurses in AIDS Care, which is a nationwide, worldwide organization for nurses who are in care of people living with HIV. What I tell a nurse is that I started out in the emergency room, and I ended up doing teaching and outreach as a nurse. I ended up doing testing as a nurse. I ended up being in charge of an inpatient unit as a nurse, a case manager at Ben Taub as a nurse, into administration as a nurse. As a nurse, the field is so open, from education, hands-on nursing. It's just a wide, wonderful, open field. If you get tired of something, you can, as a nurse, you can go to another part of nursing, and you're still a nurse. I was telling my colleagues just a few nights ago, a 92-year-old neighbor called me and said, "I feel bad. Come and help me." How many times on an airplane, on the bus, you tell somebody you're a nurse or a doctor, I have this, I got this shoulder here. You're on a plane talking about the most intimate stuff. Nursing is a fantastic profession. And, and I celebrate the nurses who stayed in it and who were willing, especially in the early days, to care for patients living with HIV when they had no idea if they would come down with it or not. So I applaud the nurses from the frontier and the ones who entered the profession now. Kudos to them as well.
Thank you. Dr. Flash, let me come to you and get your thoughts on how people can get involved, maybe even enter, if somebody's thinking about entering the medical profession. But let me give you also, a friend of mine is a volunteer at Omega House. I've been to Omega House. We had a friend that was there. And so it does a great job, so I'm familiar with that. So can you tell us about some of the other activities, how people can get involved, or if they're thinking about getting into the medical profession?
Absolutely. So Avenue 360, you can go to our website, www.avenue360.org, and you can go there to receive care. We provide literally cradle-to-grave care, women's health, adult medicine, pediatrics, psychiatry, recovery support. We also, though, recognize that when you put patients at the center and you really talk to them, in order for them to partner in their care, you need to think about things like, do I have a home? Do I have a job? Do I have access to medication? Do I have access to transportation? So we also strive to address those social drivers of health for the patients that we care for. We do care for people who are living with HIV and provide medical care and dental care for them. But we also care for the larger community, and that work of prevention is so critical. As Jeffrey said, all of us at some point in our lives should have at least one HIV test. And if you're out there and your doctor hasn't offered you an HIV test, ask them for one. Nowadays, you can actually go to the pharmacy, pick up an HIV test off the shelf, prick your finger, and get an answer within 20 minutes as to whether you have HIV or not. There's no reason that we still have people that have HIV and are unaware of their status. And for those that are afraid to do that on their own, we have a very robust HIV testing group of health promotion specialists and community health workers who will literally come to your home or job and test you and be there with you and tell you, listen, you can't jump a hurdle you haven't figured out how tall it is. So let's figure out how tall the hurdle is, and we're going to jump it together. Finally, our AIDS Hospice Omega House, for those who are in their last days, whether HIV is what's killing them, or it's cancer or heart failure, or whatever it is, we will care for you there. But if you are thinking to yourself, gosh, I've been so impacted by this conversation, and I want to help, I want to be a volunteer, Omega House is an amazing place to be of service. I tell you, whenever I walk through the doors, it's like a spiritual experience because you feel the peace and you feel the love and the support. And so it's an amazing space to donate your time, your talent, or your treasure to make sure that the good work continues for people that are on the margins.
Thank you. Jeffrey Campbell?
Yes.
How do we commit and remember during World AIDS Day 35?
I think the commitment is twofold. It's the commitment to remember the individuals that we've lost along the way, because I think with every life that we've lost, we've learned something. And so I think that's twofold, but I think in addition, the commitment is also to end this epidemic. And so in talking about Allies in Hope, that is our mission, to end the HIV epidemic in the greater Houston area. We have a sole singular focus on ending the epidemic. We don't just test. We don't just do PrEP. We do those things. We do rapid start treatment for individuals that are newly diagnosed with HIV or individuals that have been previously diagnosed and out of care. We also provide housing, both for persons living with HIV as well as for individuals who are homeless. And because we understand that housing is health care, and that is important. We have our Stone Soup Food Pantry that is significant to helping address food insecurity for individuals. And then one of the things that's really close to my heart is Camp Hope. Camp Hope is a 27-year initiative of our organization. It is a camp that was started for children living with HIV 27 years ago, at a time when many of those children were not living into young adult or adult life. This year, we had our first live camp since COVID. And one of the great testimonies of that camp is that we only had one 7-year-old. Now, what that means is that fewer and fewer children are being born with HIV. So that again is a testament of the work that we are all doing to end this epidemic. So for Allies in Hope, you can reach us at our website, www.aihhouston.org. You can find out more about us there, www.aihhouston.org. You can also go online at that web address. You can make an appointment for testing to get into our Rapid Start initiative, and even to find out more information about Stone Soup and our housing services that we do provide.
Well, thank you very much. And Jeffrey Campbell, Pete Rodriguez, Dr. Charlene Flash, I want to thank you all for the time that you spent talking to us about AIDS, HIV, here on the 35th anniversary of World AIDS Day. And as we remember the theme, remember and commit, I think that you brought us all a lot of inspirational messages and a lot of good background and about information about the good work that you're all doing. I want to thank you very much. And I want to thank you for watching the show with us as we celebrate World AIDS Day, or we commemorate World AIDS Day, and give you the chance to remember and commit. For Houston MediaSource TV, I'm Gene Preuss. Thank you very much.